All right, so welcome everyone. My name is Ingrid Severson. I am so pleased to welcome you all to today's first session in our 5-part training on motivational interviewing. We call it MI in July with our presenter, Dr. Kristen Dempsey. Today is session 1, an introduction to motivational interviewing. We are so grateful to be funded by SAMHSA and also want to be clear that the views and opinions expressed here by our presenter is hers only. So honored and excited to hand off the mic to today's presenter, Dr. Kristen Dempsey.
Great, thank you so much, Ingrid. Motivational interviewing, and we talk about motivational interviewing also in the context of providing trauma-informed care. And these are two things that are very close to my heart and are very much part of the core of my work. So I just am delighted to be able to share that with everyone. So I am a motivational interviewing trainer. I am a counselor educator. I teach at the Wright Institute in Berkeley, California, also at San Francisco State University. I have a private practice also in the San Francisco Bay Area. So I am talking to you now in very, very cool San Francisco, probably the coolest place on the planet right now. Well, maybe not the coolest, but definitely probably in the lower 48. So I'm kind of grateful for that right now at this moment. And today I'm going to get right into it because I have a lot to cover in a very short period of time. And I am going to just do a brief kind of breezy view of what motivational interviewing is. Many of you, I'm looking at the chat box, you're telling me that you've had some motivational interviewing, you've reviewed a bit of it. If you've had no motivational interviewing, I hope this gets you interested in thinking about, wow, I'd like to have more. And the way I've designed this is that I am going to do this overview, which will be, what I usually do maybe 6 hours, I'm going to put into 1 hour, and we'll pull all this together, some of the high points. But the good news is you keep coming throughout the week. I am going to expand out some of these ideas. So we will be practicing the micro skills of MI, not today. So if you were disappointed and you wanted to practice today, come on back. We're going to practice those throughout the week. And I'm going to just keep linking motivational interviewing to other concepts, to trauma-informed care, to developmental issues, mostly, kind of values and strengths development. I'll be talking about what we call micro MI, right? Motivational interviewing, Kevin systems. So there's a number of different pieces I'm going to bring in, as well as integrating motivational interviewing with other evidence-based practices like cognitive behavioral therapy in particular. So we're going to pack a lot in here in these afternoon meetings. So I thank you for your attention and your patience. And this is where we're going to go today. We have these 5 objectives. I'm going to talk a bit about the spirit of motivational interviewing and a little bit about the process and the micro skills, and also a bit about this idea of change talk, which is a distinct concept that's really critical for motivational interviewing. It's what really distinguishes motivational interviewing from maybe other person-driven approaches. And I'd like to have you think about how might you use 2 MI skills or some of these concepts in your work as you leave today. So I anticipate there will be things I say today that, even though this is not a full, huge MI training and we don't have coaching, that there will be enough of what I say that's really based on probably training you've already had, that you'll be able to identify a couple of things you would like to take back to your workspaces, things you'd like to try out, things you'd like to reorient to. I want you to think of those things, because at the end, I want to have a little conversation about that. I'm also aware that we're on this medium of internet and screens, which is not a very warm medium necessarily, super efficient, but it's kind of cold. So I tried to warm it up. And the way I try to warm it up is I'm going to ask you to have conversations with me. I'm going to throw out some ideas, some questions, some just things. And I encourage you to really start populating the chat box. Over the next couple of days, I have other ways for us to participate. But today is going to be a chat box day because I have a lot to bring into our work. So I thank you again for this work. Um, I love to use metaphors in motivational interviewing. At some point, I came across this one, this idea of, MI is really this way of, it's really about engaging people in conversations about change. And we're just getting started here, but just opening the door. I just love this idea that when we have a motivational conversation, I don't know exactly where this conversation is going to go. That's not my job. In fact, it's for me to thoughtfully open the door without pushing people through, right? It's like ramming someone through the door. It's about this warmth and inviting people in. And that's why I'd really, again, like to invite you all to this space of, let's just go ahead and kind of open this up and see what we have today in terms of our exploration. Almost all the slides today, maybe all of them, are kind of generated from this resource. And this is the main text, Motivational Interviewing, Helping People Change by William Miller and Stephen Rolnick. These are the developers of motivational interviewing. This is a third edition. Word on the street is there's supposed to be another edition out in a couple of years. So just might be thinking about that. This book is an excellent book. It will really help flesh out any ideas or thoughts you have about motivational interviewing. And I checked before our meeting today, our website. I think it's a little bit behind, but it has on our website motivational interviewing. We have members of our network of trainer kind of community in over 50 countries. And this has been translated into 35 languages, or at least some aspect of MI has been translated into 35 languages. I know that's old data. It's been expanding. And I hold that very dear. I think that speaks really importantly to how motivational interviewing, because it's so person-driven, really allows people from all over the world to have some way of connecting. Now, that said, another reason I really want you to use a chat and think about how you're going to use this when you go back to work is I want to be culturally and intellectually humble. I don't have all the answers. I never will. There's different ways of applying this or different ways of thinking of motivational interviewing. And I would really love you to be thinking about, as I talk about spirit and skills and process, how might this really fit for the folks I'm working with, right? How might this really translate when I'm, working with people in Guam, I'm working with folks in Kentucky or New York or wherever you're calling in from, right? There's different ways that we all use these skills. So this is a broad brush, but I want to be really thoughtful about how we're applying it, being, again, culturally responsive to the folks we're working with. I always like to start here. This is our technical definition of motivational interviewing. And it's in 2 sentences. It's a beautiful, elegant definition, because in 2 sentences, what we have is really all the core concepts of MI, certainly not fleshed out, but almost everything you would touch on in the book. So a lot of our theory, you could actually link back to this particular definition. And goal is actually in here twice. And it's really critical to have goals, because without goals, we don't have direction. And in order to change, we need to know, like, where am I going? Right? One of the biggest inhibitors, in my opinion, around change is being really overwhelmed, being really unfocused. So goals give us a sense of direction. I always call it the compass. You'll also notice we have here a style of communication as opposed to, say, like a counseling style or some sort of theoretical orientation. We talk about it being a style of communication because so many people use motivational interviewing. It's a way of having conversations about change. It started in substance abuse counseling, but I teach MI in schools, teach MI in corrections or carceral systems, teach MI in healthcare, like general healthcare, primary healthcare, hospital services. All kinds of folks are learning how to have these conversations because so many people who work in social services, who work with helping people, it's all about helping people have conversations about change, and MI helps us do this. Some of you are noticing, like, yes, people's personal motivations for, and that's this idea that we are all motivated towards something, right? And some of you are also noticing, I'm looking at what you're all looking at here, about eliciting and exploring. We don't know what it is that really drives people. We don't know what it is that really interests them until we start to ask and explore and be curious. Curiosity is a really important piece, but a curiosity with a real respect for person, not just me trying to dig up information, but me just really wondering what's important to you. And then we're also, of course, looking at folks' own reasons, things that really drive them drive them toward change, drive them to move away from what we call the status quo, which is things as they are. And I love this idea too, that we're doing this all within an approach. I'm almost thinking of like motivational interviewing inside like a soft kind of world, a soft kind of globe of acceptance and compassion. I'll be talking about acceptance and compassion soon, but it's really this idea of course, being non-judgmental and really wanting to work for the benefit of this person. I'm compassionate, so I'm identifying with this person's needs and their desires, what it is that's really going to be important for them to reduce their suffering. And tomorrow I'm going to be linking all of this to trauma-informed work. And those of you who are interested in trauma-informed work, those of you who have the language, you're probably already starting to see just how all of this is starting to connect. How motivational interviewing is a way of having trauma-informed conversations, not just conversations about change, but trauma-informed conversations.
Do you know of any resources using MI that have questions, case studies, etc., that have a focus of using early childhood situations versus clinical situations?
There are a great book on motivational interviewing for youth and young adults by Sylvie Nar. Sorry, I'm forgetting her co-author here, that came out, I believe, last year. It's a wonderful book, and it's mostly about young adults and like adolescents. However, she does also bring in pieces around parents as well. I mean, again, I think with motivational interviewing, we're really thinking about people who have verbal capacity, because we're having conversations about change, not really generally. And again, some of you may know differently than I do, but generally not using with real small kids. I mean, because they don't have the same verbal abilities as probably 11-year-olds and up. But family members, parents, absolutely. Oh, there, Marianne Soares, thank you, is the co-author. I love this book. Please look up that resource. It's an excellent resource. It has everything. It has not just some case studies and applications, but it actually has a way that she kind of shifts formulation for young people, right? The things I'm talking about today, she really thinks, based on research, she's an incredible researcher, about all the different components of motivational interviewing that they found were really important for young folks, like especially, probably not surprising, things like focusing on change talk, focusing on supporting people's autonomy, for instance, focusing on values. And the spirit of motivational interviewing, I find, is particularly important for what I call creating kind of the fertile ground for motivational interviewing. I'm going to talk about the skills a little bit later on, and the rest of the week we're going to practice some of the skills. And the skills of MI are great, the micro skills. And there's 5 main ones that we use here that we promote. And I am willing to bet every single person on this call, and we have like 400 people on this call, I'm willing to bet that all 400 of you have been taught micro skills at some point. Like, you all know them. And the way to think of it is the micro skills are important, and they are strategically applied in motivational interviewing in order to support this movement towards change. So that's awesome. So you can be doing the skills in a wonderful way. You can be so great at providing the perfect reflection, a beautiful open-ended evocative question. And I will say this, if it's not coming from the place of spirit, your beautiful skills might not matter. In fact, I'm going to say they probably don't matter. Whereas I can come from the spirit, from this great place of values and attitudes. And as long as I really have my heart kind of in the right place, maybe I don't do the most perfect, most beautiful reflection. If it's coming from a place of true acceptance, really being compassionate, collaborative, and allowing someone else to talk, that is, allowing them to be evocative, is probably going to be that much more effective So I'm going to say this, the thing to master, if you're thinking, what do I master first? What do I practice first? Practice identifying with, kind of connecting with like the spirit of MI, like really kind of going to that place and really thinking, am I truly collaborating with someone? That is, can I go into a session and allow my person I sit with to be, choosing the direction? And of course, I'm probably going to consult with them and then help kind of guide that process, right? Because I have a 15-year-old coming in and talking about, their use of cannabis, and they may have a feeling about their use of cannabis that might be very different from the adults in the world. I mean, there's going to be a conversation that's going to happen there that probably they're not going to totally have everything they want, and we'll probably be certainly helping them start where they're interested. So we really try to collaborate and find partnership, because what's so important is to recognize everyone is motivated towards something. I really can't say that enough. And that's where the collaboration part comes in, where it's very easy to be thinking about, I have a job to do. I have to get this kid back into class. I have this person who, is maybe needing to adhere to a medication plan, whatever it might be, right? I had this sense, but we try to avoid always fixing people and instead partnering, finding that sweet spot of where they're willing to have a conversation. And that's where we start. There's a great saying, I actually get this from DBT. So this is from dialectical behavior therapy. It's not from MI. I'm very clear that I'm borrowing this, probably from Marsha Linehan herself, which is, it's better to be effective than it is to be right. And that's like a real spirit mantra for MI, right? Because I can be absolutely right that this 15-year-old in front of me really needs to quit smoking weed, right? But if they're not there, it's so much more important for me to be effective to get them back to that next session. Maybe they want to talk about getting along with somebody in school. I don't know what it is, but there's something we can work with that, get them engaged, keep them coming back. And gradually what happens is often many of the concerns people have are often linked. And you start to build confidence, build self-efficacy, get results. We often build a connection to the other concerns that people have. The next piece we have is compassion, right? And that's this desire to really want to reduce other people's suffering. And again, we all have requirements of our work. We have things we have to get done. We have jobs we have to do, paperwork to fill out. All of that's really, really important. And in all of that, how do we stay focused on the person in front of us, who might need a little bit of extra advocacy, who might need a little bit extra focus, might need a little extra conversation about something that might be different from what I'm thinking is my job that day, right? So how do I be, again, as person driven as I can? Really try to think what's in the best needs of this particular person. Everyone's just so different. Being evocative is this idea of, how do I talk less and allow the person who's sitting with me to talk more? And this is hard. This is hard for us, especially if we have someone who doesn't really want to talk, right? We have someone who might just be pretty silent. And if that's where a lot of people have found their power, is I'm not talking to you, it might be slow go as we build trust and we reflect on the process or reflect on our nonverbals. We have maybe we have more pauses because we're really trying to make it so they talk more, we talk less. One, so we don't try to fix people. Two, so we don't overwhelm people. We don't lecture folks. All of this is very hard, but it also allows us to hear more of what they have to say, because the more they talk, the more we're going to hear the language of change, more than likely. And that will give us more material to help shape the conversation toward change. And then finally, we have acceptance. And acceptance has a lot of different components. Of course, it's about really being non-judgmental, right? This idea of people show up, maybe this is the 15th time they've been to a treatment program. And instead of wondering or being annoyed with why they're at the treatment program for 15 times, it's like, welcome back. Person knows where to go when they need treatment. What did you learn from the other 14 times you were here? Like we embrace the person. We really support their absolute worth. We support their autonomy. We look for places that that we could affirm. It's really important for us to have, accurate empathy as you're thinking about the spirit of MI. It really allows us to be in a place like if we're really in the spirit where when we're having conversations, we are allowed to, really allows us to dance with people, this idea of like being able to be in sync with the folks that we're with. And when you're in sync with someone, right? And you're moving together in a conversation as opposed to when you're wrestling with someone. When we're wrestling, it feels like we're pulling teeth and pushing someone along. We're probably out of the spirit. So I would like you to think of a time when you were in the throes of change. And maybe you had some change conversations with someone, maybe when you were a young adult, maybe when you were training in your fields, could be with a supervisor, a mentor, a teacher, family member, boss, someone who really helped you having conversations about change. What kind of things did they do that have really allowed you to engage and to feel like you were moving along with them, like you were wanting to engage, you wanted to dance and move along with them as opposed to resist them? You can see how these all really connect, right? Like when things are moving along, when you feel good, it's true for anyone. These spirit pieces are in place when we're feeling good about change and we're lit up and we want to make change. And I remember when I first learned motivational interviewing, I found myself a little bit confused. Like, okay, I have these things that I'm doing and I'm reflecting and I had kind of spirit, but I didn't quite know, like, well, where am I with someone? And I like to think of the processes. It's kind of like a map for us. It's kind of a nice map for us. And it gives us a sense of, wait, okay, kind of a little case formulation, right? Like what's going on with this person? And these are the 4 kind of foundational processes. I'm going to explain them in a minute. But just again, for your metaphorical kind of connecting here, it's like we're going up steps. We're moving towards something. You'll notice they're gerunds, right? They're verbs where we're engaging, we're focusing, which means that we're kind of always doing them, right? It's like it's a process. It's absolutely a process, not like, oh, we've engaged or to engage or, or to focus. No, it's always this process. I'm continuing to engage. And sometimes it feels like that bottom engaging plank is like a mile long. Take a long time to engage folks. And it's also like a layer cake that each of these processes build on each other. Right? So it makes sense. It's somewhat linear that we tend to engage when we first meet someone and we move towards planning. And just to give you an idea of the larger picture of things, I'm going to get back and explain each of these, but I want to show you something. This is what I do is I often transpose the process onto the trans-theoretical stage of change. Some of you may recognize this. This is from Prochaska, De Clemente, and Norcross, and they published on this, I think as early as the 80s, they're publishing on the stage of change. It's so common, and everybody's kind of really familiar with the stages of change. And let me just go through this really quickly just to make sure we're all on the same page. We start often, kind of the first kind of area of stages of change is what we call pre-contemplation. And it's where we don't necessarily think we have a problem. Right? It's like, I have no intention of changing my behavior. I'm in the status quo. They used to sell these t-shirts in Rolling Stone magazine. Like, I'm dating myself. This is in the 80s. And it said, I don't have a drinking problem. I drink, I get drunk, I fall down. No problem. Right? That to me is like the most pre-contemplative like statement, right? Like I could be doing things and, and having all sorts of stuff going on. But I don't think it's a problem. Now, this is important because think about what we often refer to folks who maybe have stuff going on, maybe they're doing various behaviors, they don't think it's a problem, but other people might. What kinds of words do we usually use to describe those folks? Go ahead and put in the chat box. For someone who typically is pre-contemplative, again, I don't think I have a problem. Yeah, so Taraf got that. In denial, non-compliant, stubborn, lacking insight, delusional, right? In denial. Don't see any resistant. There, Amy got the resistant, clueless. These are not very nice words. These are not patient, client-centered words. These are not the type of language we like to use at the beginning of the webinar that we had on our screen. And yet, this is the way, I mean, it's the way I was trained. It was totally the way I was trained. No wonder there are so many people who came to see us in substance use treatment who weren't really wanting to come back. Who wants to come back if you don't think you necessarily have a problem? And this is kind of how we label folks. So in the stage of the change, we're really at, someone just doesn't have, they're just not intending to change behavior. And what we do is we just get curious with people, like, hey, help me understand, like, what brings you here? What kind of things are other people saying? What do you think about that? And we just develop discrepancy maybe between what they're doing, like maybe their activities and maybe some of the outcomes. If you're drinking and you're getting drunk and you're falling down, is that always no problem? Just help me understand that. And often people will move into the next stage there, which is more of a contemplative stage, right? And that's where true ambivalence comes in, where I can maybe think like, there's times I like this, times I don't like this, and I'm not really sure. At times I like to drink, times I don't like to drink. I like to party, but then I don't like getting kicked out of school, right? So there's both, and we used to think of that as like such a difficulty. Oh, these people who are ambivalent, what a pain in the neck. And that's really a wrong-minded way of thinking that, because ambivalence is actually a gift. Someone who's changing, moving from the status quo into like change, is going to go through ambivalence. Think of anything in your life that you changed. And think about, did you just wake up one day and all of a sudden do something totally different without going through some sort of, I'm not really sure. Some people do, but not necessarily. I smoked for many years and I finally quit smoking. I have quit date, December 27th, 1997, a long time ago. And there were at least 3 years of pure ambivalence before that, feeling two ways about it, not really being sure. And over time, like, we can work with that ambivalence. We can kind of continue to build that discomfort with the status quo just by being curious, helping to turn up change talk, and then get somebody into a place of really preparing. And the preparing stage is when we're at cognitively, know I should be doing something, but behaviorally, I'm not quite there yet. Not quite there. And that's where we can do a lot of coaching, helping people maybe do micro steps, kind of checking things out, testing the water. What do you think? Anything you could do for yourself between now and next week? Let's try this out. Let's do a little experiment. And those kinds of things can move people forward. I believe a lot in little steps before we get to the thing we all want, which is action, which is somebody's actually going to class. Somebody is not smoking weed anymore. Somebody is maybe exercising the way they want to exercise. Somebody is, practicing getting along with others, whatever the piece may be. And then we have maintenance, like really trying to maintain our behavior over time and really being able to sustain new lifestyles, maybe be able to react differently and over time change a lot of aspects of how I am in my environment. We'll talk a little bit more about maintenance later in this week, because I think that's where a lot of our macro MI comes in. How do we help people in the larger community take care of themselves? And then of course we have relapse, where someone can, I wasn't drinking, but now I am drinking, and people kind of come back into the cycle, right? Come back into the cycle again. Sometimes it's pre-contemplated. I don't think I have a problem. But sometimes people come right back into an action stage. So we can see where that happens, where people can come back right where they were and like, okay, I need to get back in this. I need to see my sponsor. I need to, continue. And one thing I do like to really focus on here, it's one of the pieces I'd like to say, is with people relapsing, often it's internalized majorly or in a small way from a lot of people as failure. Like, I failed at something, I didn't do this right, what's wrong with me? And like I say, some people it's not that big. Some people it really stings them. It really keeps them from not wanting to try again. It's just too humiliating. It's very, very hard. And so I'm really big in teaching people about FAIL, F-A-I-L. Whenever there's a lapse or a relapse or whatever term you want to use. Some people don't like using the word relapse. Some people like return to use or return to old behavior. But I do teach people about fail, which is first attempt in learning, right? Which is, that's what that means. Like there's no such thing as a fail and like, I'm a failure, I'm a bad person. It's like anytime we shift a behavior, we didn't quite capture it, it's about what do we learn from that? I expect folks not to make it entirely perfectly the first time they make a change. So what do we learn from our first attempt in learning and use that as a place of growth? So now that I took you through that little dance of the theoretical stages of change, you see I have over here on the right our process, and really our process is all this pre-action stuff. Engaging is a lot of what we do in pre-contemplation. We help people focus a lot of times in pre-contemplation and contemplation. Many times, all that ambivalence in pre-contemplation, we are being evocative. We are evoking all the reasons and the needs, some of the ideas, and the first steps, all that stuff around change. That's where we often generate tons of change talk. We start to collect it all up, and then the planning, as you might anticipate, corresponds really nicely to the preparation stage as we start to prepare as we go into action. When you're in action stage and you're working with folks you're working with, because you're from all over, right? You're from all over, you're doing all kinds of jobs. What kinds of practices are you doing? Are you doing cognitive behavioral therapy? Are you doing narrative therapy? Are you doing psychoed? Are you doing health education? I could go on and on. When someone's in action in your world, what kinds of things are you doing with them? But how do you get to action? How do I get someone to say, yeah, I'm interested in signing up for DBT, or yeah, I'll participate in the CBT group, or yeah, I'll practice mindfulness meditation to help with my anxiety. I'd love to do art therapy. You do that in the action stage because you've just done potentially a whole bunch of motivational interviewing, right? Motivational interviewing is what creates that engagement. It moves people from, I don't know why I'm here. Someone made me come. So many people are mandated to treatment, right? I have to be here because my mom's making me come, my boss is making me come, my partner's going to leave, probation, whatever it might be. This is how we engage folks. We engage them, we get people curious, we help them focus on what's important to them. Once they're focused, we really, tell me more about that. We start to listen for all the reasons for change, start to listen and collect that change talk, and then move into the planning stage. That's how we start to gradually move from this idea of pre-contemplation or contemplation, getting prepared into action. So my point is motivational interviewing isn't something that you do instead of your regular work. Motivational interviewing works perfectly with what you're already doing. Motivational interviewing allows you to do the great work that you're already doing. So thank you for sharing all your practices and thinking again, like, wow, how can I be using MI with the folks that I'm using to help them get on board so I can do the goal setting, the expectations, learning how to live independently, doing ABA. I want to move into the micro skills right now just to make sure we get these covered. Now, many of you have heard of OARS, OARS. We have these beautiful OARS that were put here. And I love the metaphor, the little saying we have, you can't get anywhere without your oars. You can imagine, going through that process, going up those stairs, like with your oars, pushing you forward. And each of the oars plus one is a micro skill, and the micro skill that helps move us forward. So let me go through each of these. We have affirmations. So affirmations is the A. It's how we notice and how we then reflect upon people's strengths. We're looking for strengths, skills, characteristics. Why do we affirm people? Well, we want to describe their strengths and their abilities instead of just praise them, because what we're trying to do is we're trying to help build self-efficacy. We're trying to help people see that they have the ability to change. Why change if I feel like I'm broken? And again, for a lot of folks that have been in systems of care where they feel like they've, potentially, or they've been in lots of trouble for lots of reasons, where they feel like, I just can't do this. I don't deserve doing this. I don't have the skills. I can't get this done. But when I start to notice people's strengths and reflect back their wisdom, their courage, their intelligence, and many of you have probably seen this in the work that you do, you can actually visually see people like brighten and get engaged and want to continue to move forward. Reflections, I like to think of as almost like the mortar that holds all of my work together, but especially in motivational interviewing. I kind of feel like you can't use reflection enough. Reflection, I have like little metaphors. Reflection is like a mirror, and the mirror back is like, I I help somebody have psychological safety when I'm able to hear what they say, reflect it back again, the idea of accurate empathy and acceptance, and it goes back to them, and it's like, I see you, I hear you, I am responding in a way that's safe, that's open, that's, with compassion and loving. Like that helps people recognize I can go on, I can keep talking. And because of that, reflections are counterintuitive in a lot of ways. We end up getting much more connection and much more material from a reflection than we do from a bunch of questions. Questions are good, but we use them sparingly and strategically because questions can be overused. Because I think accurate empathy and this idea of mirroring is so critical for trauma-informed care and for starting to meet with people and really join folks who have had a history of trauma. I mean, anyone really, but I'm really thinking especially folks who've been traumatized and need to feel safe. Open-ended questions. So again, this idea of the metaphor here is opening the door. And the opening the door and open-ended questions is when we ask a closed question, like, do you like going to school? Of course, most youth like hate that question anyway, but that kind of thing can be like yes or no, right? Can you tell me your favorite subject in school? No, I can't. But if we find ways of like, help me understand what are some of the most important reasons for you to graduate, like you can't answer that with like a simple yes or no question. People need to have narrative around that. And with that narrative, we can start generating, especially with well-placed evocative questions, we can really start generating that precious change talk about what about this is important for you? How could you do this differently in order to have a different outcome? What kinds of things are really meaningful for you? If you did do this, how might your life be different? Oh yes, I'm seeing like Patricia's like, what do you like best about your classes, right? These are things we're trying to get what's meaningful for people, what they actually want to build on, what actually kind of really moves them towards a change dynamic. Because what we're doing in motivational interviewing as you're going up those steps, as you're moving into engaging people and helping them focus on a topic and then exploring in depth that topic, when we explore that topic in depth, what we're doing is we're starting to generate all this change material, change verbiage, and that starts to shift momentum. When I was in grad school, I had a clever professor who said, how do you move a river? And of course, we're like, this is going on. We're all like, I don't know, what are you talking about? It's like, how do you move a river? It's like, what you do is you go by and you gradually like dig a little ditch by the side of the river and the river gradually shifts. Obviously not a real practical thing to do. Although in California right now, sadly, you probably could move some rivers that way. Not enough, not a lot of water, but this idea you kind of come alongside and you have these reflections and especially asking this change talk, we're moving the energy from, I got this problem, principal made me come, I hate it here, to all of a sudden we're talking about, yeah, I want to graduate because if I don't, I won't be able to live on my own. And I want to be able to be independent and I want to be able to do my own things. And I'd like to be able to have this kind of, we're having that kind of conversation instead of one that's about why are people picking on me? And then summaries. Summaries are a great way that we actually collect material. Summaries really help with that idea of focus again, right? The idea of a compass where I'm listening to someone for a while and you know how it is, go talk. And sometimes we're all over the place or we're we're confused or overwhelmed, people will say this, oh my gosh, I got so much going on. You must think I this and that. You must think I'm crazy. You'll say that. I don't use that term, but people sometimes say that. And it's like, nope, what you're going through is completely makes sense. And then we summarize what I'm hearing you say is, you have this going on with school and people on your back around this. You want to be able to keep your job, but you're feeling really overwhelmed. And summaries really help us kind of collect material. They help us move up those stairs. Like when I first meet someone and they're engaging with me, I might summarize all the dominant themes that are coming up and say, I'm hearing you got all this stuff. Where would you like to focus first? And later on, we talk about change talk. I say, oh, I'm hearing all these reasons and needs that you have for change. What would you like to do next? They help us move along conversation, help organize material. They help us link back maybe to something that was talked about earlier. So it provides a lot of change energy. And then the last one here, the plus one, is what we call elicit, provide, elicit. And in kind of more less fancy terms, call it ask, offer, ask. And ask, offer, ask is how we give information and advice in motivational interviewing. It's such a great skill. What ask, offer, ask is, it's a way of asking permission and also assessing need to give advice. So how about that? How many times do any of us, I know I've done this, we just say, oh, you should do this, right? Why don't you do this? And someone doesn't want to do that. And the worst thing I do is say, well, just do this. And of course, what do people do? People push back, right? People don't like to be told what to do. Think about times when someone's given you the best advice and you just can't take it, right? It's not because it's not good advice, it's just the way it came across. That's really important, especially for folks who are ambivalent. So if we say, hey, I'm hearing you talk about this thing, and you're just so frustrated with your class and you just don't want to be there, you needed to graduate, it's so annoying, have some thoughts about this. Would you care to hear them? Would this be helpful for you? Or, I'm hearing you say there's all this stuff in class you're so annoyed by. I'm wondering what kinds of things have you been thinking about that might help you out? So I'm seeing if they need anything, what they've already been thinking, and then the provide or the offer, maybe those are 2 or 3 different ideas. You could always go and ask for help and tutoring after school, or you could ask maybe about talk to your teacher about ways you could make things up, or maybe you find a way of taking the class next term. Like to give a number of different ideas, right? Because if we give one piece of advice, you know how that goes. You tell someone, hey, you should do this. That's great, but that's not going to work for me. Or why don't you try this? People we pitch them and people just keep rejecting them. It's called the yes but, right? The yes but dynamic. But if we give someone 2 or 3 different things, especially if one is theirs, we try to be very specific and brief, clear. Don't want to prescribe the response. Now, I don't want to say you're going to love this, because what if they don't? But if we give people choice and then we say our second ask, or the second elicit, so what do you think you'll do? Often people will come up with something, well, maybe I'll talk to my teacher. I can't tell you how many times I've used this approach with folks who might have been pretty, you're not going to be able to help me. And lo and behold, they really show up. So these are our 5 micro skills. I'm wondering in this group, how many of you recognize all or some of these skills? Do you have a favorite? Do you have a favorite skill here that you like to use? Reflections, again, I think are so important just to really reinforce kind of the main driver of the work. Open-ended questions or any questions can be overused. And in a kind of a longer day-long training and motivational interviewing, we have a little exercise where we do this. We have people go and over question each other, and they can feel how annoying that is. But what we're trying to do with reflection is we're really trying to make a guess and reflect back in a statement, rather than asking how things are going for folks. It yields more information and better understanding. And often a question that we want to ask can be turned into a reflection. So I really do encourage people kind of early on, think about ways to practice reflections. And again, we're going to have more of a chance to really get behind those tomorrow. And I'm noticing many of you are already kind of looking at reflections. We're trying to think of, a reflection as a hypothesis. instead of, this question, be thinking about what does this person mean? When I kind of replay this back, like, what does that statement mean? Like, there's always something kind of underneath the surface. Sometimes we talk about a statement that someone makes is just the tip of the iceberg, like what's underneath that. Or conversely, I think about the reflection is like a layer of the onion. What's underneath that? And in general, we try to make reflections so they are not that much longer than someone's statement. We can have simple reflections in which we just repeat back an element of what someone says, or sometimes we can have rephrasing where we state what someone says, but maybe use slightly, rephrase, synonyms. Yeah. So if someone says something like, I need to get all over I need to get over all this baggage. Maybe like a restatement might be just me saying, oh, baggage. Like I just reflect that word, right? It's so simple. It does just kind of moves along the discussion. It's not adding any additional meaning at all. I'm antisocial. So what I'm seeing there. And so maybe a rephrasing would be just like, yeah, you just really, whatever they think of antisocial as, it could mean a lot of different things, but in that case, it's like, you really don't like to go out and talk much with people. You don't like to socialize. So that rephrasing there is staying pretty close to someone's meaning, right? It's not really going in any deeper way. But then we do have other types of reflections here that I do like to include. And sometimes we have, like, these are more complex reflections, right? Where we have paraphrasing, where maybe we have more significant rephrasing, in which someone infers a meaning what was said and reflects back on new words. And it usually kind of adds to and extends what was said. Just looking at stuff that's showing up into the chat box. My family expects me to mess up. So maybe I would say something, again, you have more context than what I have right now. So I'm just kind of making things up. But if my family expects me to mess up, maybe it's something like, it's really hard for you to, figure out like what to do next for yourself, because there's anticipation that, no one expects you to be successful, right? So there's a little more that I'm adding there, right? I'm talking about in this context that maybe they aren't going to participate much in the session because, they're feeling like they just can't be a successful person. It moves a little bit beyond my family thinks I'm going to mess up, right? It's just taking that information, maybe going a little bit deeper. Continuing the paragraph is where sometimes we might add on like what the person could say if they were going to keep talking. So we wait for them to complete their statement, and then maybe I add as a reflection, again, this additional information I think might be where they're going next. So for instance, my dad has never liked me. And then maybe my continuing the paragraph is, and that leaves you feeling just really alone and misunderstood in your family, right? So you can see how that might very much like add depth to what this person's saying, right? So I'm talking about a feeling there, and just gives you a vision of like what might be happening in that family. There's a reflection on feeling, where many times we look at all these statements that people are putting in here. There's so much feeling that's just underneath the surface of everything that someone's saying, right? So it's like something we could say, my family expects me to mess up. And maybe I could, say something like that. And that has you feeling really hopeless. Has you feeling really hopeless and like there's really no purpose in trying. I'm working on my diet. And maybe given the context, I might say something like, and you're feeling really hopeful that you're going to be able to start seeing some success. So it's this idea of being able to start to think about, like, where people are, kind of feeling in terms of the affect. And so Yvonne has something really interesting here too, the complex reflection to dad never liked me. That leaves you feeling rejected and not good enough. That's great. I would just, you have a question mark there, I would make that a period. So that's a thing we have to do in the reflections, is make sure that we don't inflect up at the end and make them into questions, and just boom, period at the end. And that leaves you feeling rejected and not good enough. But when we speak metaphorically with clients too, sometimes that really allows people, a sense of being able to see themselves in relation to another narrative, another story, another perspective. And that sometimes can really open people up to this, different way of seeing something. They can see themselves in the story. I like this one. I got this one from a DBT community, which I really liked, where someone might come in and maybe they're saying like, I don't know why I come here. I'm not sure if I can really trust you as a provider. My probation officer wants me to see somebody, and everybody I see, doesn't really help me. How are you going to help me? I got everybody on my back. And so maybe a metaphor I might use there is something like, it's really hard. You're feeling like there's so many people, kind of out there, kind of pulling on the rope against you, and you're kind of pulling on the other end of the rope. And, maybe, part of what I could do is just kind of help get on your side of the rope and kind of help pull, like we can kind of help work together on what it is that you're trying to do. Not that we're going to collude with them, but this idea of like, how do I partner with you to kind of help you kind of get what you need and feel like you have somebody on your team kind of idea. Double-sided reflects both sides of the conflict, and this is great when you're working with ambivalence. Someone might say something like, I don't want to be here in session. It's actually a great one, right? Where it's just like, so I'm really getting the sense that you really don't want to be here. And I'm also noticing that you're here and you're willing to talk to me right now. So what we're trying to do is we're trying to reflect like the status quo of like, I don't want to change on one side and the change talk on the other side. And you'll notice I do and instead of but. And so think about that. I want to include both the status quo of like, I don't want to be here, and here I am on both sides. Why do I use the and instead of but? This is actually really important. But kind of incites a challenge. So now someone thinks that I have to go and defend my not wanting to be here. It's almost like, oh, you don't want to be here, but here you are. Even if I'm not saying it that way, that's the way it can be interpreted. But if I do a real gentle, I get it. You really don't want to be here. You know what? And you're here. You're here and you're willing to work, right? That's a much more like, I'm hearing you. I don't want to ignore what you're saying, but I'm also noticing, that you're actually here. It's all powerful stuff, like powerful pieces. And amplified is strategically overshooting the content or feeling in order to get someone sometimes to back off of the status quo. Sometimes people just come in just really like, I'm going to say something and I'm going to just almost like a challenge. Like, this is my favorite one. Adolescent comes in. I really, I love weed. I love smoking weed. You can't make me quit weed. Weed's natural. It makes, it does all this great stuff for me, even though like they could be having all sorts of problems, right? That's why they're there potentially, but I don't really have problems. Everyone else has problems. I love weed. So with someone like that, anything's going to feel like potentially a confrontation. So what I do is it amplifies. I actually try to go a bit beyond that even, right? Because there's a bit of an overshoot. So they don't feel like they have to keep defending weed. Because what they're doing is they're thinking, I'm going to go and try to convince them like, oh no, you shouldn't use it. And then we're kind of in a power struggle. So what I do is saying something like, wow, I'm getting like, you're really into weed. Weed's like your best friend. Like there's nothing really more important to you than weed. And often that gets folks to step back a little bit. Like, well, I mean, there's other things in my life that's more important than weed. Oh, okay. So there are some things that you really care about. They can reflect on that. Also, if people don't do that, and they say, yeah, in fact, that's true. Weed is my best friend. That's fine. I mean, I just kind of keep working with that, right? It's like, oh, okay, so just help me understand how that's occurring, because that might be a status quo that just definitely requires some exploration, and we can learn. And here's the thing with motivational interviewing is it's important just to stay in the spirit and not, again, to slip into. It's so tempting to move into those places of, I really feel like I have to problem solve here. I have to fix something. And we really don't. I mean, it's like, I was doing a demonstration a couple of weeks ago with someone was willing to demonstrate with me. And there was, some material in there that when we started to do the demonstration that it's probably like an alternate reality. You know what I mean? It's like it's something that was come from their perspective that probably not a lot of people would have shared being a particular reality. And I could have gotten like so caught up into like, oh my God, what do I do with this material? What do I do with this material? It's it's I had to fix this. They're saying stuff that's just really like delusional or whatever. That's not my job. I just got really curious about everything and just help me tell you a story. And in the storytelling, like reasons to do something different started to show up, like different desires to do something different. And I just kept reflecting on that change talk and whatever it was that was bothersome beforehand. And I'm being deliberate in my case here to be very vague about for confidentiality, but we really started to shift down a whole path of how they were coming to a place of things they could do differently on their own. And we really were able to move away from all that content. So that's where it can be just be very helpful of just staying kind of relaxed and in the spirit and not feeling like we have to go in and challenge somebody's perceptions or values or anything like that. Right? Just being purely curious and having conversations. Great. Okay. So I know we have a few more things here. Look at my time, being aware of this. And again, talking about the open-ended questions, they do not invite the short answer, leave a broad latitude for how to respond. We're going to get a chance to talk a little bit more about open and closed questions. I'm just being aware of our time here. But this idea of like, just to give you some ideas, you could we'll just do a couple here. You could put this in the chat box, but just to be able to train your ear to listen to this. Like, what would you like from treatment? Does that sound open or closed? Was your family religious? Closed, it's a closed one, but you could probably make that open, right? Like, tell me a few things about your family's spiritual background. Tell me about your psychiatric medications, the things that are good and not so good about them. Open or that's open. Yeah. Sometimes we do that, the good and not so good. That's a way of being able to do both. If you were to quit, how might you do it? That's an open one too. A lot of times the how and the what are more process oriented. When is your court date? And I have, I think, another slide here that you can practice on here. Oh, I don't. I took that out because I knew we wouldn't have time. And then with affirmations, again, affirmations, my metaphor for here's a magnifying glass. Because we're noticing things about people. We're noticing ways that they have strengths, right? And we're looking at like, what's a strength or a positive action? This idea, we're really trying to show that we care about somebody and it does function to strengthen our relationship. So we're looking at like, what kinds of things are, catching people being good, so to speak. You're a strong person. You're a real survivor. Sometimes it's a statement of appreciation. I appreciate your openness and honesty. Also just thinking and noticing that somebody came in or just saying, hey, I like the way you said that, of like being able to just really see somebody in the present, like being, functional basically. So we want to, again, catch people in their competence because we have to spend so much time really focusing a lot of times on deficits in terms of our documentation and on justifying seeing people, but they actually change, all of this change by leveraging our strengths, right? Like noticing what we're doing right. That's what's so important to connect to. And here's something, again, for time purposes, I'm going to just kind of really summarize this slide as think about descriptions instead of evaluations. So instead of me saying something, oh, that's so good, you're going to go back to school. Because what if that person next week decides they didn't want to go back to school, right? Now it's kind of awkward because I was so into it and they may have changed their mind. But what if I say something like, I notice, I hear, I see, it's like, I notice that you really put so much work into looking into going back to school. I just had this sense like you're focusing your determination. So what I'm doing is I'm really noticing that the skills, the energy, like the things, the qualities they have. It's about going back to school. We want to be thinking about this competent instead deficit worldviews of folks. What's really distinctive and creative and wonderful about them. Generally, we have to think about how often we use these things, right? We don't want to use so many affirmations in a meeting that it seems fake. So maybe if we have like 3 affirmations maximum during a session. And I talked a little bit about summaries earlier, but really let's think about how do we use summaries to organize somebody's experience, to link back to maybe something that was discussed earlier, or maybe even to transition to a new task. I encourage people to use summaries like at the beginning, like, okay, so this week, we're going to go through this. We went over this and this and this last week. So we can kind of link all the stuff together. It really helps to focus our ideas so we're not wandering off. Again, back to bringing our compass into play. Sometimes I do it in the middle of session. Okay, let's just make sure I'm tracking things. And then I also like to do a summary before we finish up at the end, especially, and also I do summaries throughout of change talk. Because if I'm hearing the desires, the reasons, the needs of the change for somebody, I want to be able to really work on that. But again, this idea of always asking permission, offering different options and ideas, and then asking again, like, how does this land? How does this land for folks? And then finally, we're going to change talk. And I've been talking about change talk all over the place, right? Change talk can happen at any time during a session. It can happen as soon as people come in. But a lot of times it happens after we've been talking to people for a while and we find an area of focus. And I'll just kind of finish up by saying that change talk can be divided into what we call preparatory change talk and mobilizing change talk. And preparatory change talk are like desires, ability, reasons, and needs to change. I really want to quit smoking. I know I could quit smoking. If I quit smoking, I could save money. I have to quit smoking. I want to be a good role model. And what we found is that in the research, that preparatory change talk doesn't necessarily lead to action, right? You talk the talk without walking the walk. But what it does lead to is mobilizing change talk. And mobilizing change talk is where we have people get activated to change. So it's like, I'm committed. I have a quit date. I will quit on this date. Activation is, I'm willing to. I'll consider talking to that doctor about a patch, taking steps. I've cut back. I was smoking 20 cigarettes a day and now I'm smoking 10. So change talk is, important part of the weekend. We could see it at any moment, any time in the process. We often see it in the evoking stage. So just as a review, we engage folks when they first come in. What kinds of things are really important to you? We help summarize, like, these are your dominant themes. Where would you like to start? What things could we focus on? Maybe we make a list of the things they want to focus on. And other things on your list today. Maybe we talked about staying in school, quitting smoking, getting along with my sister. What do you want to practice? What do you want to focus on? Want to focus on getting along better with my sister. That's where we start to ask evocative, open-ended questions. How will things be different if you and your sister get along? What are some reasons for you to get along with your sister? We start to have these curious conversations where we're reflecting and affirming, gather things together, summarize the change talk we hear. And that often leads us into an area of planning. So what I hear you say is that it's really important for you to get along with your sister because you really value being close. You've been close before and it was really important to you and you want to keep that up. And, you want to be able to spend some nice time together this summer. So given all that, where would you like to start? Right at the end. So I'd love to think, like, given all that you've had in your head today, right? So much stuff. What kinds of things would you like to bring back from where you started today? What things are you interested in learning more about in the next 4 days? Where would you like to go with all this? And think about the couple of things, especially that you learned today that you'd like to use in your work.
All right, so we have quite a bit of other programming. Check out the Pacific Southwest MHTTC's website for all this good info. All sessions that are recorded can be found on the website. Okay, of course, we're on social. You could find us on Twitter, Facebook, and Instagram. And in closing, a huge thank you to Dr. Kristen Dempsey for everything that she's shared so far. And we're excited to see you in all sessions you're able to join coming up.